What I'm about to share with you could change everything you think you know about vitamin B12. If you are over 55 and you take vitamin B12 every single day, I need you to stop what you're doing and listen very carefully for the next few minutes. Because there's a strong chance you are taking it completely wrong, and it could be silently damaging your nerves, your memory, and your energy without you even knowing it. Last week, a 68-year-old man named James walked into my clinic. He sat down across from me, looked me straight in the eyes, and said, "Doctor, I don't understand. I've been taking vitamin B12 every morning for over 7 years. My blood test says my levels are normal. So why am I still tired? Why are my hands going numb? Why do I forget words in the middle of a sentence? Why does my balance feel off when I walk down the stairs?" I hear this same question almost every single week from patients over 55. And here's what shocked James when I explained it to him. He wasn't lacking vitamin B12. He was taking it the wrong way. And that one simple mistake was undoing everything he was trying to fix. In this video, I'm going to walk you through the exact mistake most seniors are making, why most doctors completely overlook it, and the correct way to take vitamin B12 so it actually works for your brain, your nerves, and your long-term energy. Stay with me until the end, because the last part contains the one tip that helped my patient walk without fear again. Let me start with something most people get wrong from the very beginning. Most folks believe that if their blood test shows a normal vitamin B12 level, then everything is fine. The doctor said it's normal. The lab said it's normal. So that must be the end of the story, right? Wrong. In adults over the age of 55, that assumption is one of the biggest health mistakes you can make. And here's why. Vitamin B12 is one of the most important nutrients in the human body. It's responsible for keeping your nerves healthy, supporting your brain, helping your body produce red blood cells, and giving you the energy you need to live a full life. When your body doesn't have enough usable B12, your nerves slowly start to malfunction. That's when the symptoms begin. Tingling in the hands and feet, a burning feeling in the soles of your feet, trouble keeping your balance, forgetting names, losing your train of thought, feeling tired no matter how much you sleep. Now here's the problem nobody tells you about. As we get older, our body's ability to absorb vitamin B12 drops sharply. By the time you turn 60, more than half of all adults have reduced stomach acid. And stomach acid is absolutely required to pull vitamin B12 out of food and out of standard supplements. Without enough acid in your stomach, the B12 you swallow simply passes right through your body and gets flushed out. You get nothing. Let me tell you about a patient named Margaret. She was 71 years old when she came to me. She was complaining of burning sensations in her feet, frequent dizziness, and what she called brain cloudiness. Her previous doctor had checked her B12 level. It came back at 420. That's technically inside the normal range, so she was told nothing was wrong. But her symptoms kept getting worse. Why? Because here's what most people don't know. A standard blood test for B12 doesn't actually show how much B12 is getting inside your cells. It only shows how much is floating around in your bloodstream. Big difference. In older adults, B12 can look perfectly normal in a blood test, while your nerves are literally starving for it. This is the reason so many seniors take B12 faithfully for years and feel absolutely no improvement. The number on the page looks fine, but inside the body, the nerves are still crying out for help. And here is where the very first major mistake happens. Most seniors take vitamin B12 as a regular tablet and swallow it down with a glass of water in the morning. They assume it will absorb just like any other vitamin. But after age 55, that's often not how it works at all. You see, in order for B12 to be absorbed from a swallowed tablet, your stomach needs to produce a special protein called intrinsic factor. As you age, your body produces less and less of it. Without intrinsic factor, the B12 you swallow has nowhere to go. It just leaves your body unused. This isn't rare. This is incredibly common. James, the patient I mentioned earlier, was doing everything right. Same dose, same brand, same time every morning, and his nerves were still getting worse. When we changed the form of his B12, not the dose, just the form, his symptoms started improving within just a few weeks. The form of vitamin B12 matters just as much as the amount you take, maybe even more. And in the next section, I'm going to show you exactly which forms work and which ones are wasting your time and your money. Now let's talk about the second big mistake seniors make with vitamin B12, and this one is everywhere. Most people are taking the wrong form of B12 entirely. Walk into any pharmacy or grocery store, look at the B12 supplements on the shelf, and you'll see one name printed on most of those bottles: cyanocobalamin. It's cheap, it's stable, it has a long shelf life, and it is the least effective form of B12 for older adults. Here's why. Cyanocobalamin is a synthetic, man-made form of vitamin B12. Before your body can actually use it, it has to convert it into the active form. That conversion process requires a healthy liver, proper enzyme activity, and good antioxidant levels. In adults over 55, that conversion process slows down dramatically, so you swallow your B12 every morning, and most of it never gets converted into something your body can actually use. Let me tell you about Robert. He was 72 years old, a retired engineer, sharp as a tack. He had been taking cyanocobalamin for years. His blood levels looked acceptable on paper, but he kept complaining about numbness in his fingers, and he was starting to have trouble walking without holding on to something. We made one simple change. We switched him to methylcobalamin, the active form of B12 that your body can use right away without any conversion. Within 1 month, his balance noticeably improved. Within 3 months, the numbness in his fingers had decreased significantly. He told me he could feel his coffee cup again. This isn't a coincidence. Research clearly shows that the active forms of B12, methylcobalamin, and adenosylcobalamin are absorbed and used far more efficiently in older adults compared to cyanocobalamin. But the form isn't the only issue. There's also the question of timing. Many seniors take their B12 once in the morning and assume that's enough for the whole day. The problem is that B12 is water soluble. Your body clears it from the bloodstream very quickly. If you have absorption issues, which most seniors do, a single small daily dose may not give your nerves the steady supply they need to actually heal. This is why some people feel a quick burst of energy after taking B12 and then crash later in the afternoon. Their nerves are never getting consistent support. There's also a big myth I want to clear up right now. Some people believe the only real solution is getting B12 injections from the doctor. That's not true. Injections are useful for severe deficiency cases, but they are not always necessary. A high-quality sublingual B12, the kind you place under your tongue and let dissolve, can be just as effective for many seniors. Sublingual B12 bypasses your stomach completely. It bypasses the intrinsic factor problem. It absorbs directly through the tissues under your tongue. For seniors with low stomach acid or any digestive issues, this can be a game changer. The lesson here is simple. If you're over 55, swallowing a regular B12 tablet might give you normal-looking lab numbers, but it's not protecting your nerves. The form matters, the delivery matters, and in the next section, I'm going to share the most overlooked mistake of all, the one that quietly cancels out the benefits of B12 even when you're doing everything else right. Here's the mistake that surprises most of my patients, because it has nothing to do with the dose or the form. It has everything to do with timing and consistency. Many people only take their vitamin B12 when they feel tired. They skip days when they feel fine. They stop taking it as soon as their symptoms get better. Then a few weeks later, when the fatigue creeps back in, they start again. Friends, that is not how nerve tissue heals. Vitamin B12 is not a stimulant like caffeine. It's a repair nutrient. Your nerves need a steady, daily, uninterrupted supply of B12 to rebuild damaged myelin. Myelin is the protective coating that wraps around your nerves like insulation around an electrical wire. When that insulation gets damaged, your nerves can't send signals properly. That's when you get the numbness, the tingling, the balance problems. Repairing myelin takes time. It takes weeks, sometimes months. When you skip days or stop and start, you interrupt the entire repair process. I had a patient named Elaine. She was 70. She told me she only took her B12 on days when she felt exhausted. On those days, she felt slightly better. But her numbness, her balance issues, and her memory problems never actually improved over the long run. When she finally started taking B12 every single day without skipping, things changed. After 2 months, the tingling stopped getting worse. After 4 months, her balance had clearly improved. She told me she felt like her old self again. There's another timing issue I want to mention. Many seniors take their B12 right before bed. For some people, this can interfere with sleep because B12 supports energy production. Poor sleep raises your stress hormone cortisol, increases inflammation in the body, and actually slows down nerve repair. So in some cases, taking B12 late at night can quietly work against you. For most seniors, the best time to take B12 is earlier in the day, morning or early afternoon. This supports your energy and your nerves without messing with your sleep. Hydration is another piece of the puzzle that most people overlook. Vitamin B12 works inside cells that depend on proper fluid balance. Mild chronic dehydration is incredibly common in older adults. If you're taking B12 but barely drinking any water during the day, your results are going to be limited. Drink your water, friends. And finally, there's the medication issue. Many seniors take medications that interfere with B12 absorption or function. Acid-blocking medications for heartburn, metformin for diabetes, certain antibiotics. I am not telling you to stop your medications. Please don't do that. But I am telling you that if you're on these medications, you need to adjust how you support your B12 levels because your body has extra obstacles to overcome. Most seniors aren't doing just one thing wrong. They're doing several small things wrong at the same time, and each little mistake reduces the benefit just a little bit. Add them all together, and you can completely cancel out everything B12 is supposed to do for you. Now let me walk you through exactly what I tell my own patients to do. This is the protocol I use with adults over 55 in my clinic. First, the form. Choose methylcobalamin, or even better, a combination of methylcobalamin and adenosylcobalamin. These are the active forms. Your body can use them right away without any conversion process. Avoid relying only on cyanocobalamin, especially if you already have nerve symptoms. Second, the delivery method. If you're over 55, don't depend on swallowing a regular tablet. Choose sublingual B12. Place it under your tongue, let it dissolve slowly, and let it absorb directly through the tissue in your mouth. This skips the stomach entirely and solves most of the absorption problems we've talked about. Third, the dose. For most seniors who need real nerve and brain support, low doses tend to fail. The body needs higher amounts to overcome those absorption barriers. A common effective range is 1,000 to 2,000 micrograms per day. Some people need a little more in the beginning and less for daily maintenance. And don't worry, B12 is water soluble. Any excess is safely flushed out through your urine. Fourth, consistency. Take it every single day, not when you remember, not when you feel tired, every day. Nerve repair is slow and steady. Skipping doses interrupts the healing. Fifth, timing. Take it in the morning or the early afternoon. Avoid late evening doses if you find that B12 makes you feel alert. Sixth, supportive nutrients. B12 doesn't work alone. Folate and vitamin B6 are often needed for full nerve support, but be careful with high-dose folic acid. Natural folate or methylfolate is usually better tolerated, especially in older adults. Seventh, monitor your progress the right way. Don't judge your success only by a lab test number. Pay attention to your body. Are your hands less numb? Is your balance better? Is your thinking clearer? Are you sleeping better? Are you walking with more confidence? These changes matter so much more than a number on a piece of paper. I had a 75-year-old patient who followed this exact protocol. After 3 months, her lab values had only changed slightly, but she was walking better. She had stopped falling. Her confidence was back. Her family told me she seemed like a different person. That is what real success looks like. Now, I need to be honest with you about something important. Vitamin B12 is powerful, but it's not magic. There are situations where B12 alone won't fully solve the problem, no matter how perfectly you take it. Long-standing nerve damage is one example. If you've had nerve compression, spinal degeneration, or diabetic nerve damage for many years, B12 can support healing, but it can't reverse severe structural damage overnight. Blood sugar control is another factor. High blood sugar damages nerves directly. If you have prediabetes or diabetes and your blood sugar isn't controlled, your nerve symptoms will keep coming back no matter how much B12 you take. Chronic inflammation is a silent blocker too. Poor sleep, chronic stress, and a sedentary lifestyle all raise inflammation in the body. If you ignore these, your B12 has to work twice as hard and gives you half the results. And sometimes the problem is misdiagnosis. Not every case of numbness or tingling is from B12 deficiency. Pinched nerves in the neck, carpal tunnel syndrome, and other types of neuropathy can all look similar. If your symptoms keep getting worse, please see a doctor for a proper evaluation. Don't just keep increasing your supplements, hoping for a miracle. I once had a 73-year-old patient who doubled his B12 dose on his own after reading something online. His symptoms didn't improve. They got worse. When I evaluated him properly, we found out he had spinal stenosis. His nerves were being physically pinched. No amount of B12 in the world could fix that. Once we addressed the real problem, his B12 actually started helping again. Before I let you go, I want to leave you with one final story. A woman in her early 70s came to see me after watching a video very similar to this one. She had been taking B12 for years and was convinced it just didn't work for her. When we reviewed her routine, nothing she was doing was technically wrong, but nothing was being done quite right either. Wrong form, swallowing instead of sublingual, inconsistent, judging success only by lab numbers. She changed just a few things: the form, the delivery, the consistency. 3 months later, she sat in my office and told me something I will never forget. She said, "Doctor, I feel steady again. I trust my feet when I walk down the stairs. I don't lose my words in the middle of a sentence. I feel like me again." That, my friends, is the difference between taking a supplement and actually using it correctly. If you're over 55, vitamin B12 is not optional, but how you take it matters more than most people realize. So tonight, before you go to bed, take a look at your current B12 routine and ask yourself one simple, honest question. Is this actually supporting my nerves and my brain? Or am I just checking a box? If this video helped you understand something important about your health, please share it with someone you love, someone over 55 who might be quietly making these same mistakes without even knowing it. Subscribe to this channel for clear, evidence-based guidance made specifically for adults over 55, and leave a comment below. Tell me what form of B12 you're taking right now and what changes you're planning to make after watching this. Thank you so much for spending this time with me today. Take care of yourselves, and I'll see you in the next video.